Hi, everybody. Thank you so much for being here today. I'm Stephanie Chestnut. I am a licensed marriage and family therapist with Dartmouth Health Behavioral Health Solution. So, today we're going to be talking about something that is unfortunately very real in our workplace: violence and aggression from patients and their families. So, there's a security component of this, of course, but this is also about your mental health. So, we're here to share some practical tools for recognizing and de escalating tension and to focus on coping skills and emotional support. So, stay tuned. I hope that this presentation will be helpful to you. Violence and aggression in healthcare isn't something new, but we've been seeing a clear rise in these incidents nationally and locally. Healthcare workers experience nearly half of all non fatal workplace violence injuries, even though they're only about 10% of the workforce. That's a really huge imbalance that really tells the story. So, recent surveys show that 76% of healthcare workers have experienced some sort of violence on the job. So, that can be verbal, physical, and about one in three have actually had a physical assault. And verbal aggression is very common. So, it's not just the physical injuries, the reports of harassment in healthcare settings have doubled since 2018 and 2022, from 6% to 13%. That trend reflects something many of you have probably noticed and experienced yourselves. These incidents don't just hurt physically, they leave a lasting emotional impact. Fear, anxiety, hypervigilance. Staff can start to dread coming into work. We see increased burnout, and we even see people leaving the profession altogether. So we know that this isn't an abstract issue for you, it's very personal. You yourself may have experienced aggression, seen it happen to a colleague, worried about it happening. And so we want to acknowledge that reality honestly. But more than that, we want to help you feel supported. So this session isn't so much about policy enforcement or protocols, though there is a little bit of that, but it's about your mental health and how we can help you cope, recover, and stay well while doing this demanding work. Now that we've talked about why this topic is so important, let's define what we actually mean by violence and aggression in the workplace. It's easy to only think about physical assaults, things like hitting, pushing, grabbing, throwing objects. Those are clear cut and they're serious. But verbal aggression is incredibly common and just as important to address. This includes yelling, cursing, personal insults, threats, and even things like mocking or belittling staff. Harassment and intimidation can take many forms. That includes things like blocking somebody's path, getting in their personal space, using threatening body language. And then, of course, we have sexual harassment, which is sadly part of the picture too. This can include sexual comments, unwanted advances, or non consensual touching. The key message here is all of these forms of aggression are serious, all of them matter. Even when there isn't physical contact, the psychological impact can be real and damaging. Verbal abuse can leave staff feeling unsafe, anxious, demoralized. We want to make sure that everyone here knows that these behaviors are never acceptable and it's okay to name them and to seek support. As we consider the topic of workplace violence in healthcare settings, so it's really crucial to understand that the consequences extend far beyond the physical injuries. There is a deep emotional impact that these experiences have on healthcare professionals. Many staff report living in constant state of fear and hypervigilance, never knowing when the next incident might occur, walking on eggshells. Over time, this creates a sustained stress response in your body, eroding a sense of safety and stability in what should be a healing and safe environment. There's also the emotional toll of anger, frustration, and resentment. And often that's not just towards the aggressor, but towards the system that fails to adequately protect you, which that is a valid feeling. These feelings can simmer below the surface and contribute to interpersonal tension among colleagues. Anxiety and dread about coming to work can become a common experience. We see that people who once felt passionate about their jobs begin to question whether they can continue. The emotional exhaustion can just be really overwhelming and it can spill over into your personal life. After incidents, many staff experience guilt or self blame, especially if they feel like they didn't respond the right way. These internalized feelings can really compound trauma and delay emotional recovery. Many people also describe feeling constantly on edge, irritable, short tempered, emotionally reactive in ways they never used to be. And these aren't signs of weakness, they're signs of a nervous system that's under siege. Ultimately, this leads to burnout, compassion fatigue, and higher turnover. These struggles have institutional consequences: decreased morale, lower quality of care, staffing shortages that affect the entire system, and camaraderie among colleagues. Trauma and moral injury are very real outcomes of repeated exposure to violence and aggression at work. So, first, trauma responses can show up even if there wasn't a severe physical injury. Emotional trauma can include things like flashbacks, like where you keep playing the incident in your mind. You might avoid certain patients or rooms or shifts. Some people feel constantly tense, jumpy, on edge. That's what we call hyperarousal. It's important to recognize that these are normal reactions to something that feels threatening. Your body and mind are just trying to keep you safe. And then there's the idea of moral injury. This is when something about the experience feels like it violated your own sense of what's right and wrong. Maybe you feel betrayed by the system for not protecting you, or powerless because you couldn't help a patient without risking your own safety. Sometimes it sounds like, I shouldn't have to endure this to do my job. Moral injury can be especially painful in healthcare because so many of us entered this work to help, heal, and care for others. When we're treated violently or abusively, it can really shake our sense of purpose and meaning. All of this can erode our well being, drain our empathy, and make it harder to stay engaged at work. One of the most powerful tools we have to avoid violence in the workplace is simply awareness. So, spotting early signs of aggression and agitation can give us a chance to de escalate or get help before things get out of control. Some of the warning signs are really pretty clear, like people pacing, fidgeting, raising their voice. You might hear a change in tone that signals anger or frustration that's about to boil over. Threatening language and gestures are big red flags. Even if they don't say, I'm going to hurt you, you might hear things like, you'd better fix this in a menacing way, or see them shaking a finger in someone's face. But a subtle important sign is when somebody starts to move from demanding to refusing to listen to explanations and getting more hostile the more you try to help. Physical cues can matter: clenched fist, red face, tight jaw, moving in closer, blocking your exit, invading your personal space. One of the things that's true for experienced staff is you start to develop a gut sense about when something feels off. So be sure to trust that intuition because that's there to help you. Recognizing these signs doesn't always mean you can stop the escalation, but it does give you more options. Calling for help earlier, setting clear limits, removing yourself from the situation before things get worse. So, just as important as recognizing escalation in patients and their families, it's also recognizing it in ourselves. So, we are human. When somebody is yelling, threatening, or intimidating us, our bodies and minds react, and that's totally natural. That's your stress response kicking in to keep you safe. Some of the physical signs to watch out for include a racing heart, tight jaw, clenched fists, shallow, rapid breathing. You might feel a rush of adrenaline, like your fight or flight response is gearing up. Emotionally, you might also notice your anger rising quickly, feeling like you want to snap back, argue, prove you're right, or it could be the opposite. You might feel fear, freeze up, and shut down completely. So, self awareness is key here. Recognizing that I'm getting activated response gives you a chance to choose how to respond instead of just automatically responding. And none of this is about blaming yourself for feeling stress or experiencing violence. It's about understanding your own warning signs so that you can use your skills to stay safe and steady. If we're flooded with stress ourselves, it's much harder to de escalate anyone else. Now, let's talk about some practical skills you can use in the moment, starting with the most important place: yourself. When you start to notice your own escalation, like that racing heart or clenched jaw, the first step is to pause. Even a single intentional deep breath can help interrupt that fight or flight reaction. Try this. Inhale slowly, count to 4, exhale slowly, count to 4. You can do this discreetly even while the person is talking. It sends a signal to your nervous system that you're safe, helping you stay clearer and calmer. Grounding is another helpful technique. That might mean consciously feeling your feet on the floor, noticing your surroundings, mentally reminding yourself, I'm safe, I'm here. Once you're regulating yourself, pay attention to your tone and body language. If you stay calm, steady, and non threatening, the other person is less likely to escalate. And that can be really hard when we're feeling activated. Speak soft, slow, and low. That helps regulate the other person. Even when you're feeling angry or scared, model the tone that you want to see. Speak slowly and clearly, keep your hands visible and relaxed. Avoid crossing your arms or getting into a confrontational stance. They're not magic fixes. They don't guarantee the other person will calm down, but they can help increase the odds and help you maintain your own sense of safety and sense of control. So now we're going to dive deeper into verbal strategies that can really help in the moment when somebody is feeling upset or aggressive. So, first, show empathy. Remember, that doesn't mean agreeing with everything they say or giving in to unsafe demands. It's just about acknowledging their feelings. Examples might include naming what they're experiencing. I can see this is really upsetting to you. It sounds like you've been waiting a long time. That's really frustrating. I understand you're worried about your family member. This is really hard. Even just saying, I hear you, can help the person feel less ignored or dismissed. Next, use clear, respectful language. It can be really hard, especially when somebody is yelling at you or swearing at you, but calm, neutral words lower the emotional temperature. Try phrases like, let's talk about what we can do. I want to help you, but we need to talk calmly. I'm here to listen. I'm here to help. Avoid matching their anger or using sarcasm, even if it's really tempting. That can escalate things quickly. Setting calm, firm boundaries is essential. This tells the person what is and isn't acceptable without threatening them. Some examples could include, I want to help you, but I can't allow yelling or threats. I need you to lower your voice so we can keep talking. I understand you're angry, but I can't let you block the door. Boundaries aren't about punishment, they're about safety and respect for everyone on staff. Finally, offering choices can help someone feel more in control, which often reduces aggression. For example, you could say, you can wait here, or I can check in with you in a few minutes. Which would you prefer? Or would you like to sit down while we stop talk, or would you prefer to stand? I can get the charge nurse, or we can keep talking here. Let me know. Choices, even small ones, give people a sense of agency, which can help de escalate power struggles. Again, these strategies don't guarantee that somebody will calm down, but they can increase the chances and they can help you maintain your own sense of control and professionalism in a tough moment. Most importantly, though, if you're ever feeling unsafe, it's always okay to step back, step out, and ask for help. So let's talk about knowing when it's time to get help. De escalation skills are important, but they don't mean you have to handle everything by yourself. Recognizing your own limits is part of staying safe. So if you notice that you're feeling truly unsafe, like if somebody's making threats, blocking your exit, brandishing an object, not calming down, that's the time it's time to step back and call for help. So you can use code alerts or designated emergency numbers to summon security. Don't hesitate to ask a colleague to step in if you feel overwhelmed and unsafe. There's a lot of safety in numbers. Involve your supervisor or charge nurse early if things are escalating. Sometimes staff worry that they'll get in trouble for like making a scene or overreacting. And I just want to be really clear, there's no shame in asking for help. You have the right to feel safe at work. Using these resources isn't a failure of your skills or professionalism, it's what those systems are there for. So, one helpful mindset is to just plan ahead. Know where the panic buttons are, where the phone numbers are, who the security contacts are in your unit. Know who you can quickly turn to for help. So, what should you do immediately after an aggressive incident? Your first priority is immediate safety. Before anything else, you want to make sure the scene is secure, meaning you, patients, and other staff members are safe. Don't rush to get back to normal if there's any risk of the person returning or tensions flaring again. Alert your colleagues, security, supervisors about the potential for repeated aggression. Next, do a quick self assessment. Ask yourself, am I able to focus right now? Is my decision making clear? If the answer to that is no, it's a sign you need a structured pause before proceeding to other patient care. Use structured pause tools that you might already know from clinical practice. SBAR for communicating what happened clearly to colleagues, SAFER or stop, reflect, plan approaches to slow the reactive cycle. Even simply saying, team, I need a couple minutes to clear my head before the next patient. That can prevent cascading errors. These approaches help maintain safe, effective clinical care under stress. Engaging in a peer debrief is another evidence based strategy. You can use these conversations to process and learn what triggered the escalation, what interventions worked or didn't, what can the team do differently next time. Hospitals that normalize structured peer debriefs see improvements in team cohesion and lower burnout rates. And then finally, document the event carefully using institutional reporting channels. This is also a coping tool. It validates the seriousness of the event, supports future prevention, and protects you legally. There are some practical self care strategies that can help us stay healthy and effective in the moment, after an incident, and over the long term. First, immediate tools include grounding, so that's orienting yourself to your environment deliberately. This can be as simple as naming 5 things you see in the room to break out of tunnel vision. There is deliberate breathing. Slow, intentional breathing lowers the adrenaline and helps regain cognitive control. You can inhale 4 counts, exhale 4 counts, and repeat as necessary. And taking even 1 to 2 minutes away from the clinical area can interrupt spiraling stress. Post incident reflection is crucial for integrating the experience instead of continuing to carry it like baggage. Journaling or writing a brief note to yourself about what happened and how you responded can help externalize the event. Narrative reconstruction is a proven approach to trauma informed care. Tell the story in your own words, identify what went well, what was hard, what you wanted to learn. So, these stress management basics matter even if they sound obvious. You also want to protect your sleep as much as possible, especially if you're working shift work. You want to prioritize nutrition, avoid living on coffee and snacks from the vending machine. Include movement, even short walks on break, stretching. Those can reduce physiological stress. You can access more in the moment and longer term coping strategies in the DHBHS Coping Strategies booklet, which you can find on Cobalt and by scanning the QR code you see on your screen. Building emotional support networks is also key. This means leaning on trusted colleagues, peer support programs, or professionals like EAP or DHBHS. It's important to have spaces where you don't have to filter or sugarcoat your experience and you can feel heard. And finally, protect your sense of purpose and meaning in this work. Aggression and violence can make us all cynical. Finding ways to reconnect with why you chose this field. Find patient wins, team solidarity, reflect on your personal values. These can be a buffer against burnout and help sustain your compassion over time. So let's expand from self-care in the moment to building personal resilience over time. So this is about proactively maintaining our ability to keep doing this demanding work and do it with humanity. Again, recognizing your own triggers and stress signals. We all have certain patient behaviors or phrases or incidents that set us off. Know what they are for you. Know what activates your stress response. Watch for your physical signals in your body. Be aware of your body. Self awareness isn't just emotional, it's about safety, it's about maintaining professionalism, and it's about being in tune with yourself. Next, develop intentional recovery routines. This doesn't have to mean taking a week off or going to a retreat. It's just small, consistent practices that help reset your baseline. Take a regular walk after shifts. Take a few minutes of stretching or breathing before bed. Have a ritual for closing out your workday mentally, even if you're on call. These routines can help your nervous system return to baseline instead of accumulating stress over weeks and months. Practicing self compassion and realistic expectations is also crucial. Violence and aggression can trigger self blame or second guessing, like, did I cause that? I should have seen this coming. It's important to remember that even perfect communication can't prevent every escalation. You're not going to be able to please or calm every patient. Being effective doesn't mean that you never experience aggression. You also want to advocate for a supportive team culture. Debriefing shouldn't be an afterthought or treated as complaining. You want to normalize it. Share without blaming. Support colleagues in calling for help early. Back them up also when they set boundaries with patients or families. And finally, maintain your connection to your personal values and mission. Healthcare work is meaningful, but exposure to violence erodes that sense of purpose. Actively reconnect with why you chose this field. Latch on to patient success stories. Latch on to meaningful moments of teamwork with your colleagues. Making a difference in someone's worst day is an important calling. Protecting that connection is a powerful resilience tool. Now let's talk about reporting and support resources. First, it's important to note that reporting is not about getting somebody in trouble or being dramatic or complaining. It's a professional responsibility for your safety, your team's safety, and your patient's safety. When incidents go unreported, leadership can't see the patterns. Security and staffing can't plan appropriately. Policies can't improve. So at our institution, there are clear formal channels. There are security teams and code alerts in real time. There's the OWL system for documenting occurrences, which helps track and analyze trends. There's direct communication with your charge nurse or department leadership. And beyond reporting, you have confidential support options. The Employee Assistance Program offers professional counseling that's private and free. And DHBHS counseling services provide longer term individual counseling if you want more in depth help processing an incident or ongoing stress. And don't underestimate the value of peer support. Colleagues often understand these situations better than anybody else. You can help your teams process, learn, and support one another to encourage resilience. Validate each other's experiences. Your colleagues are the warriors in the trenches with you, and they need your support just as much as you need theirs. Before we close out our presentation, I just want to be clear about what we can realistically expect and what we can do next when it comes to violence and aggression at work. So, first of all, this is a systems issue, nationwide as well as local. Individual staff can't fix it alone, and we don't expect you to. But you can demand systems that are safer and more supportive. Reporting matters, not because it changes everything instantly, but because it creates data leadership can't ignore. Using those channels, OWL security calls, direct conversations with leadership, documenting incidents, it's a form of professional advocacy, as well as protecting yourself professionally. And second, your reaction to violence is valid. Anger, fear, hypervigilance, moral distress, these are all normal, expected responses to being threatened or demeaned while trying to help. Recognizing these responses is the first step to mitigating their impact. Ignoring them, it's not strength. It's a risk to yourself and to your patients. So, how do you actually recover after an incident? Again, immediately, you want to secure safety first. You want to take a deliberate pause, and then you want to use structured tools to help debrief. Short term, check your readiness to continue safely. Briefly brief with a peer or a supervisor. Long term, document for accountability. Reflect on what happened. Avoid self blame. And look for patterns that might guide future responses. And yes, ask for help. EAP, DHBHS, peer support. They're not last resorts, they are standard professional tools to help you maintain longevity in high stress environments. And then finally, team culture. Make space for post incident reviews that focus on learning. Support colleagues in setting limits. Be their backup. Normalize early calls for help. A safe team is one that's ready to talk about what went wrong and what we'll do next time. And if you want to take one thing away today, I want you to know you don't have to just deal with it. You deserve systems that protect you, your colleagues, and you have tools to care for yourself so you can keep caring for others. I just want to thank you for showing up today and for doing this work. I want you to know that we see you at DHBHS, and if you want to keep talking about how to make this better, how to support yourself, we are here to work with you and to support you. On this slide, you'll also find resources and references that we use to create this program. These include the data points that I mentioned earlier. So please pause to take a look at these if this is of interest to you. If you want more support and resources, you can scan the QR code on your screen. That will take you to Cobalt, which is the DHBHS hub for resources, articles, that coping brochure that we talked about, as well as being able to make appointments with our clinicians. So don't hesitate to reach out, tell us what you need, ask any questions. We're here to help support you. Thank you for being with me today.